All right, let's do it.
Mahalo for joining us today. My name is Matt Kanealii-Kleinfelder. I'm the councilman for District 5 in Puna. And joining me today is Stefan Harmeling. Stefan, introduce yourself, please, so people get to know you a little bit. Where do you work? What do you do?
Absolutely, sir. My name is Dr. Stefan Harmeling. I'm a family physician here in Hilo, Hawaii. I have over 20 years of experience as a family physician, working everywhere from local urgent cares to Hilo Medical Center, also spending time overseas in Africa as well as in Haiti. So I come with a lot of experience dealing with infectious disease, primary care issues, and hopefully I'll have something very good to say to add to the conversation about COVID-19.
I think as a doctor from Hilo, how long has your medical practice been open here?
So I've had my own medical practice since 2007, and that's Aloha Nui.
So I think a doctor in town for 13 years, I think you carry some weight with your voice. So thank you for sharing your time with us today and your mana'o.
Absolutely, absolutely.
Okay, so I think right off the bat, there's COVID happening. People have a lot of questions. So, as a primary care physician, what are you seeing right now in regards to COVID with your patients, in your practice, at the ER?
Yeah.
What are you seeing?
Well, I had some time to kind of prepare for our conversation today, and I spent some time looking at some of the statistics here in the United States, in the state of Hawaii, and also within our county. And what we currently see now is we had this really blessed period where we barely had any positive cases. We'd go 20, 30 days without anything. And now we're recording more and more cases almost every single day. It's not an uptrend, but we're definitely recording double-digit numbers each and single day. And I think today maybe it was 17. I may be wrong on that a little bit, but I think it was a good amount of numbers of folks who have tested positive today. And you always have to remember that these tests are delayed by up to 48, sometimes 72 hours. And there have been instances in which people have waited up to 96 hours just to receive a phone call from some of these testing sites. So there's even going to be a delay in knowing what the actual numbers are. So the numbers that you hear today are not particularly of today. They're actually delayed a little bit. The reason that's important is I think it's going to be up to each and every one of us here within Hawaii County to see each other as family and to take our own responsibility to wear our masks, to self-quarantine, to reduce our exposures. Too many times I've driven past, a beach park on a Saturday or on a Sunday, and, people are shoulder to shoulder. And we're seeing this steady increase, particularly among people who are Pacific Islanders, carry the brunt of this infectious disease right now here in Hawaii. It's going to be very important that each and every one of us sort of takes on that responsibility to wear our mask, to keep that distance, and to really shut this down. Regardless of pro or con, which side of the political spectrum that you sit on, it doesn't matter. I think what's important is that we all share this burden and we all share the solution. And the solution is wear your mask, wash your hands, stay home if you're sick, and self-quarantine as much as you can.
I agree. I think, if I remember correctly, correct me if I'm wrong, but
yes, sir.
To get testing right now, usually it requires a note from your doctor or your primary care physician. Is that correct?
Yeah, well, there are different ways to get tested. If you go to one of our established laboratories, clinical labs, diagnostic labs, you need a laboratory slip filled out, and that has to be from a physician. So unfortunately, within our county, we have a huge deficit of physicians. I think we have last count a 40% deficit. So that does create for many, many people some barriers to getting tested. Now, there are some testing sites that are set up that do not require a physician signature. They're not free. They do cost you something. And you can get tested there. But my experience, and I've had that experience, I've done that, is there can be a very long wait. I wish that there were numerous test sites set up at once to sort of break up the population. Today I saw on the paper, and I'm going to look it up now, and I'm going to show you this picture because this hit me as soon as we did. And so let me turn my phone around. but you know, here's the line of cars all waiting to
Yeah.
go into a testing site.
Nothing.
Now
Nothing
you can imagine, right? Now you can imagine, you know, how difficult it is sometimes just to go out and get lunch at work, right? To go out and get a sandwich and then come back in time and get things done. You can imagine needing to sit in your car for 2 hours at a time, already stressed for income, already stressed about money, already needing to work each hour that you can, how that would inhibit people from going getting a test who maybe thought, hey, I should get tested. Maybe I was exposed, but because of the difficulties with it, it's hard to do it. Listen, I'm thankful for the testing sites. This is definitely not a criticism for them, but I would like to see numerous testing sites open across the island all at once so that it's more localized, so that someone who lives down in the Pahoa area doesn't have to drive to another part of the island to get tested. And yes, testing sites do open up across the island, but they do it one at a time. And perhaps someone in the south side of the island is not able to make it to the north side of the island that day to get tested. So it'd be really nice if we could go a couple weeks with numerous testing sites where people could get tested, once again, without a physician's signature, but the ability to also look up their own test results online. I think that would also be important.
Okay. Does insurance cover the cost of those tests? Do you know that?
So far, insurance has not covered the cost of my tests.
Wow.
So I've been billed by the insurance company, and I paid it. You know, I'm in a different position where I'm able to afford the cost of the test, but so many people in Hawaii are not in that position to afford anything between $43 to $130 are what some of the tests are ranging.
Yeah.
And we've already had the huge economic downturn. So many people are out of work. So many people are on unemployment. That's another barrier for people. It would be nice to see if our local government could pick up the cost of this testing for people. I think you'd see a lot more compliance with it if that happened. Yeah, absolutely. I think that it's just like anything. You invest for a greater return on that investment. If we invest in the prevention and early detection, then we don't have to invest so much more on the treatment within a healthcare system that already can't take care of the population that we have when we have a 40% deficit of physicians on this island.
Very well said, Doc.
You know,
that's why we're talking.
Thank you, sir. I appreciate that.
Hey, since we're on the subject of testing.
Yes.
Who's offering right now? Who's doing the testing?
Well, actually, a number of different testing sites just looked up, and people can always look online, testing sites, Hawaii County, and they will pretty much tell you a lot of the times where to go. If you have a physician who will fill out a requisition for you and you are simply getting screened, you are not symptomatic, you're getting a screening test, then you can go to like the local clinical labs and most likely diagnostic labs to get those done. If you are symptomatic, the ER was one option, although I think that if you have an option of going someplace else to be tested, you should. You know, but I think looking up online at the different testing sites in Hawaii County would probably give you an idea of where they're going to be.
So you can get tested from like clinical labs, you can get tested from the Premier Medical Group, with their free testing, okay? And then the administration type, and what kind of tests are they still using? They're using the nasal swab, you know, the very deep.
Yeah.
You know?
The very deep, you got it. So I've had both. I've had the very deep nasal swab, and then I've had the less invasive nasal swab. They're both uncomfortable, but they're both also absolutely necessary. I'd rather get a really good test so I know if I'm positive or negative versus a comfortable test and then my results are questionable.
Okay.
You know, I always,
I'm asking.
Yes, sir.
Sorry.
No, please.
So when you're testing, I mean, what I've heard is when you leave the facility, the results of the test basically are null and void as soon as you leave. Correct?
Oh, what do you mean? As soon as you leave the facility?
So
you mean as soon as you're tested?
Yes. As soon as you're tested, the results are good for the test at that time. But as soon as you
absolutely.
walk off, you could have contacted for the facility. So
Yes.
what's important here for me is that if you're getting tested, you're getting a test at a very specific time, and you're walking away. And at any point after that, you could have contacted the disease.
Well, I think another important point, an even better point, and hopefully this is sort of in par with what you're saying, is testing should not be used as the #1 preventative measure. Because you're absolutely correct. Once that test is completed, that only promises what you did before you got tested. Once you leave that facility, it's all up in the air again. You could get exposed to someone with COVID-19 in the parking lot. You could get exposed the very next day. That doesn't give you any sort of reassurance moving forward. You know, so even if that test is negative, you were simply negative prior to that. I think the best way and the most important way for prevention of this illness is, once again, every single person wearing their mask, washing your hands, keeping social distancing as much as possible, and really trying to reduce the sort of social get-togethers that we all end up falling into and convincing ourselves that this one time it's okay and everyone here looks like they're pretty healthy. You know, I think across the board, it's going to be very smart, especially because we're seeing the positive cases, that we all agree: masks, social distance, stay within your immediate family, nothing more.
Okay. I've heard that there's tests on the market that give results in under 10 minutes, and they cost $25. I think it's called Sienna test. And have you heard of these? I mean, have you seen these? The tests that we have, we're waiting for up to up to almost 3 days for results, if not
absolutely
more. And yet we have tests on the market that can give us results in under 10 minutes. And I'm just trying to wrap my head around why we aren't using the most up-to-date tests available. You know, and I know it's not something that you do. It's not your decision to make. More our side. What are we doing? So how do you feel about that? You know, where does that register?
Well, of course, the faster the test, the better you're going to be, because you know the immediate result, right? So if you come into my clinic and I'm able to test you, and you can sit there like a flu swab, and 5 minutes later, I have a double line and it tells me, hey, you are positive for COVID-19. That is an absolute positive. It puts the power in our hands, because now I can immediately say, hey, you're sick. You may be asymptomatic. You may have very mild symptoms that don't require treatment. But at least now you can self-quarantine and not spread this illness, because that's the biggest factor of this illness, is how easily it spreads, right? And affecting the most vulnerable among us, okay?
So the quickness of the results is actually more important.
Having a quick test is good, but you also have to consider the specificity and the sensitivity. So how many false positives am I going to get with this test? And how many false negatives? That's also very important. So if it takes a day to have a high specificity and a high sensitivity, meaning these results are truly what they are, then it's best to wait a day.
Okay. If
somebody puts something out on the market and they're telling us, well, it's about 50% reliable, you don't know what to believe like that. You know, very similar to the IgG blood test. You know, I myself got the IgG blood test because in the beginning, that was the fastest way that I could get tested to see, have I been exposed? Because as a physician, I want to make sure that I'm keeping all of my clients safe. So I want to know what's my risk factor here. But when you look at the details of the test, the specificity and the sensitivity, you realize, I didn't really treat anything, or I didn't really test for anything here, you know? So the specificity and the sensitivity is going to be the most important thing. There are some point of care testing that's coming out now. It's a very small box. Let me look it up right now. It's BD Vera something, something, something. Let me tell you right now. And it's put out by one of our medical supply companies, and it's for testing for COVID-19. It gives a rapid result back, I think in about 20 minutes or so.
Wow.
And a lot of these skilled nursing facilities are purchasing them, because now the US government is requiring skilled nursing facilities to test all of their staff and residents on a regular basis depending on the numbers of infectious cases per population. So these things are actually going out and should be received by a lot of our skilled nursing facilities pretty soon.
Wow. Okay.
So these rapid tests are coming to the market, which is thankful and exciting and everything else. And I'm going to look up, I got to remember the name of it here. Verifone.
And what about
COVID-19 testing?
Before we jump off
Yes, sir.
testing, what about when
Yes, sir.
let's say you test positive for COVID, you're home for 2 weeks. When you are the end of your 2-week quarantine, which I think is what the DOH guidelines are, is it 2 weeks when
Yes,
you're
sir.
done? So when you're done with the 2 weeks and you're gonna go back to work, is there a clearance test before you go back? I mean, what is it? What is the precaution on the backside?
No. I mean, of course, I think it's always a good idea to be retested after you initially tested positive to make sure that you are negative, right? It's always going to be important because that's the only way to assure it. But as of now, as far as I can understand, it is not a recommendation from the CDC or the World Health Organization or things like that to be retested.
Wow.
Why? I can only assume because in many places it was so hard to get tested in the first place. If it was jumping through hoops to be tested, how many hoops must you jump through to be retested? You know, and they probably thought about the availability of resources, because if you're looking at so many people who tested positive and you're trying to retest them for negative, that's a lot of resources you're going to be used with these tests. And, is as much as some folks say there's plenty of tests to go around, there might be a lot of tests sitting somewhere, but they're not being equally distributed amongst different groups within the United States so everyone can get tested. So there might be enough tests, but they must be sitting in a warehouse someplace. they're not, maybe that might, there's been problems at the Postal Service if you haven't heard, so that may have caused some problems with the tests being shipped out.
Nice. I like that. Thank you. So we get questions about, so we have the state level has the Department of Health. And as we all know,
yes, sir.
the director and I think the deputy director has stepped down or resigned.
Yes.
Anderson
retired. I think they're retiring.
Retired, resigned, whatever happened there, I'm not quite sure.
Yes.
But I think a lot of people ask, at the county level, do we have, are you aware of any medical director? Because I am not. I don't think we have a medical director here.
Yeah, we do not have any sort of physician czar or medical director or surgeon general for Hawaii County.
Okay.
But I would love to see one because, over the years that I've lived here in Hawaii since 2005, we've dealt with the dengue fever outbreak. We dealt with the hepatitis A outbreaks. We have some of the higher rates of tuberculosis being in the Pacific. We don't have the medical facilities to take care of our population. Having a head physician to lead the charge when these health challenges occur and to bring together our healthcare community in Hawaii to address these issues, connecting the hospitals, connecting the skilled nursing facilities, connecting the private physicians, connecting the specialists, that would be so important and beneficial for our island. It would reap benefits beyond what we could imagine.
Who do you talk to now? As a physician, you have a question. Who is your point of contact right now at the county level? And I am in the county, so this is kind of a question that I should know, but I think it's important for people to understand that from the doctor point of view, who is your contact?
Right. Absolutely. My experience, and I can say I've probably called the Department of Health more times than I could count, especially when COVID-19 was first coming out. I called a lot and asked a lot of questions. And I do not believe that there is a single point person with a medical degree who's able to understand infectious disease and give recommendations about the best path forward for our community. I do not believe that the county has that person, and I could not understand why, especially in a situation where we are so medically underserved. That would be a physician that would serve the county and be able to really pick up in a lot of ways where we're failing.
That's a strong statement. I think that that provides clarity for people as far as, who is that person? Because as far as I know, if I needed something, I either call civil defense or I
Yep,
call the police non-emergency line for quarantine or for
you got it.
COVID questions. But then again, I mean, are they, do they meet the requirements to make those kind of decisions?
Right.
Especially when you're dealing with
Right.
something like COVID-19, we have a global pandemic. Do we need someone a little bit stronger in the county? It's a great point that I think.
Absolutely. And imagine if we had that sort of physician, healthcare professional who's able to coordinate with the fire department, who's able to coordinate with the police department, who's able to coordinate with the hospital, who's able to coordinate with all these different sort of first responders to make sure that we all speak as a single voice, and to be the person who sort of gets everyone in the room and goes, all right, let's all talk about what we're doing. Let's all talk about how we're going to work together as a community to make sure we move forward. And granted, any great leader can do that, but a medical physician has the experience to understand infectious disease. And that is absolutely paramount if we're going to really address COVID-19 and see it go into our past rather than chase us or lead us into our future.
Oh, Doc, you should have been a public speaker. You're doing a great job.
I want that new county physician position that you're talking about. I'm defining, when you get hired for a job, how you have to define your own job. There we go.
There you go. Okay, if anyone's listening, you heard that. You heard it here first.
But all jokes aside, I do think having that within our community would be absolute paramount. And hopefully whomever is going to become the next mayor will see healthcare as a absolute primary concern that cannot be put on the back burner, and it cannot be dealt with reactionary. It has to be dealt with in prevention and early detection and preparation. And so hopefully our next mayor candidate is really going to understand that and create a whole department around that and make sure that the health of our community improves. I
agree. Yeah, it's imperative. Okay.
Yeah.
Okay, next.
Yes, sir.
Oh, I learned yesterday that the city of Tokyo, 9.2 million people. And from what I've learned in the past, Tokyo is actually about 10 million in the evening and about 30 million people strong in the daytime. Because everyone comes into Tokyo to work and then goes back home to the country.
Right.
So with that in mind, Tokyo's active cases or new cases were less than the county of Oahu's cases yesterday.
Wow.
In comparison.
Wow.
So if we can have a city of 9.2 million people with less cases than we have in a city like Oahu, we have some strides to make in our response. So with that in mind, what are your thoughts regarding COVID preventative measures that the county should or could take to protect our health here in Hawaii?
Well, no easy answer.
Oh, and be honest,
because each time,
what are we doing? What could be
no, absolutely. Because each time that you ask us to quarantine and shut down, you have this reverberation throughout our community, affecting education, affecting incomes, affecting people's ability to care for other folks, caring for an elderly parent or a loved one. People with disabilities who rely on all these services to get around. These services aren't available when we quarantine. And everyone has to make a living, including first responders, or not just first responders, but everyone. So it's really challenging to say that, because any suggestion that I give, I'm asking people to sacrifice. I'm asking people to give a little more of themselves than they've already given since this COVID-19 thing happened. But I will say this, and I'll say this with all sincerity. Only by working together as a county and as a community here in Hawaii are we going to get through this. If we're making individual decisions because I want to do this or this benefits me, One card in a deck missing ruins that card deck. Coming together, wearing masks, washing our hands, keeping social distancing. I do think that is a great way to keep our community going. There's a question during this weekend, because it's a holiday weekend, about going to the beach and our exposure there, because that sounds like how some of these clusters may have started, is these things.
Yep.
And you're really asking a lot of people, and you're asking a lot of them, because we're asking them to change so much about their society, and human interaction is so absolutely important. But maybe this weekend, we can just stick within our own family units. We can still have the barbecues. We can still enjoy ourselves. Maybe we can still go to the beach. But maybe we'll just stay within our own family units, and we won't go visiting across the beach to a friend or something like that. And maybe coming together as a community, we can help reduce this, and we won't see another cluster come out of this holiday weekend. Because once again, listen, is the answer completely shut everything down and everyone stay in the house? Yes, of course, that's the answer. But the effects on our mental health, domestic violence, child abuse, alcohol addiction, illicit drug addiction, you know, all these different things that have come out of this quarantine, it's a lot to ask people, and it's a huge challenge. And I don't think I have quite the answer for it, other than each one take care of the person next to you, wear your mask, wash your hands, social distance, and especially this weekend, really think, you know, do I need to go out to this place? Should I go to this social engagement? Maybe staying home this weekend would be a good idea for all of us to do, to a certain degree, or at least minimize our social interaction this weekend.
Thank you. Thank you for reiterating that. I've had some phone calls saying, why can't people just wear their masks? And they call them Karens,
I mean, that's a first step.
The Karens can't wear their masks, but there's some honesty to that. Is people just have this frustration, and we have some freedoms that we all want to have, but right now, ultimately, wear your mask, wash your hands, use hand sanitizer.
You got it.
Stick within your family unit, and keep yourself, secure in your health, and in that way. Well, what about other measures? Like we talked about rapid testing. I think that would help tremendously.
Yeah.
And then
rapid testing would be absolutely fantastic.
Today we had a very long discussion on the council regarding contact tracing apps that go on your phone. How do what are your thoughts on contact tracing apps?
I think contact tracing apps are absolutely fantastic, because as you and I kind of talked a little bit before, is if you're in an area where someone has tested positive, your phone will let you know and reduce your exposure. And I think that's absolutely fantastic for our healthcare community to have that sort of early detection, that warning. I think it's great. I do. Now, of course, there's always going to be concerns with privacy.
Yep.
There's always going to be concerns with what's going to happen to my information. And I can't say I know enough about the technology to give someone concern or give them reassurance. But what I do know is that right now we're dealing with COVID-19. So as many tools as we can have within our toolbox to defeat this virus and move forward, I'd like to see it happen. If we can do it in a safe way that will respect people's privacy, I would like to see it happen. Absolutely.
Okay.
Absolutely. And I think a very important discussion to have at county council as well is what is going to happen tomorrow. Now, I know we can't predict COVID-19, but what sort of society are we going to move forward with in 2021 and in late 2020? How are we going to move forward with education? Are we going to go back to the classrooms, or are we now going to take advantage of technology and improve online education and make it a valuable option for children to choose? Because maybe a kid would do better at home, online, academically, because maybe socially a school isn't for them. I really hope we don't lose sight of, we've been forced to move forward as a community, but so let's keep going there when it comes to technology and online education. I would love to see the same options available for healthcare. I'd really like to see our community invest more and accept more of telemedicine. because that does allow someone who may be in Ka'u to see a physician in Waimea without leaving their home, you know? And so that does increase. And as technology improves, those sorts of appointments will improve. They won't just be Zoom appointments, but they'll actually be these sort of virtual medical appointments. You know, so I want to see the county council sort of address these things moving forward. You know, how are we going to sort of continue the idea of social distancing within the workplace so that COVID-19 doesn't come back up, yet still keep a running economy? And also, how do we now redefine our economy? Because we can no longer rely so much on tourism when something like this did so much damage to it. We have to find another source of income to sort of keep our island going. So I really hope that it's not just what's going on now. My concern is that would be short-sighted, is, okay, how do we move forward with the lessons that we're actively learning? That's what I'd be very excited to see the county council sort of address.
I was in a discussion with someone a few days ago, and they said this statement, and basically said, COVID is going to be here for a long time, maybe 3 to 5 years. You know, that's not that we can beat it in 2 weeks. That's out the door. So
yeah,
have
absolutely.
to be discussing solutions that address how we can deal with COVID for the long term.
Oh, absolutely, absolutely.
Won't be tomorrow.
And
so all these, this suite of tools that we have at our disposal, they have to be both what can we do now, but also how are we going to use these tools later on? And I think that's hard to wrap your mind around. We thought we could beat this. You know, we'll close down 3 weeks, and then we'll reopen, and we'll beat the virus. Well, that didn't work. So here we are.
Well, I can tell you. Yeah, I mean, I can tell you, you know, you go to the stores and they have these plexiglass barriers up. Brother, I don't think those are coming down anytime soon, if they ever come down again.
I don't think so.
They are simply going to become a part of the fabric of our society, very much how none of us expect to be able to enter the airport past security. But when I was growing up, it was an absolute given. You were walking through security right up to the entrance of the plane and hugging your loved one goodbye. And now, because of the change that happened with 9/11, we don't even consider it. It has made a permanent change within the fabric of our society, where we feel safer not being able to pass security. There will become a time where they will consider taking down the plexiglass barriers, and we will tell them we want it back up because we feel safer as a result. I tell you, it's going to change our society, and we have to prepare for it and move forward. Absolutely. The way that we build buildings, the way that we design workspaces, the way that we design classrooms, the way that we design healthcare and how we access healthcare, the way that insurance pays for it. You know, it's great now that insurance is paying for telehealth, but it hasn't always been that way. And we have to make sure that it doesn't reverse back to some sort of archaic system, but each system, whether it's healthcare, education, economics, all these different things that we face, we have to address them, realize that they're all intermixed, and we have to move them all forward. And I tell you, man, it really starts with our next leadership on this island, and I hope our mayor candidates are up to par. Or at least, I hope they're open to the idea of, hey, let me consider this and let me maybe make it a part of my agenda. If they haven't already, I hope they go, hey, that's some good ideas. Let's start doing that.
It's a great point. Yeah, we have about 3 months left in the current administration. And after that, you have a new mayor walking in, and this is not going to be an easy. It's not going to be an easy transition. This is going to be a very tough time for whoever walks in the door. So yeah, thank you.
You got it. You got it. But you know, I was thinking about leadership today, and there's a bunch of different ways you can define leadership, because we got all kinds of examples all across the United States of what people consider leadership and what people consider not, right? But I would say a solid definition of leadership is you bring out the best of those around you. When you're the leader, you don't have to be the smartest in the room. You don't have to be the tallest. You don't have to be the wealthiest. You don't have to be any of that. But what you do have to be able to do is recognize the greatness in the individuals that you surround yourself by, and bring that greatness out of them, and have chosen the right individuals for that specific job that they're going to undergo. So hopefully whoever comes in as that mayor candidate, you know, you don't have to know how to play every instrument. but you have to know how to conduct the symphony and how each instrument should be played, you know, how the sound should be effective. And that's what I'm really looking for in a mayor candidate. You know, that's what we're looking for, man. That's what we need. I hope so. I hope so, man. You know, I hope so. But if they don't realize it, it's going to be a very rude awakening, because this is a very challenging time. This might be one of the most challenging times any mayor of Hawaii County has ever faced. I mean, you have huge unemployment. You have the healthcare crisis of COVID-19. That's not going away when the mayor comes. That's just heating up. It's a brand new year.
Yeah.
You know, how do you get people back to work? How do you readjust our economy so we're not so dependent on tourism? You know, what sort of new things do we add to our economy to sort of improve it? Do we invest more in agriculture? Do we think about the idea of adding legalized gambling? Do we invest more into the idea of legalizing cannabis? You know, who knows? But I tell you, it's going to be really up to the next mayor to be forward thinking, to be very hardworking, and to really listen, because there's going to be a lot of different opinions about which way to go. And I just want them to listen to the best one.
Thank you. Appreciate that. I agree. Thank you.
Yes, sir. You got it.
So, final thoughts for the evening. Don't take up too many people's precious time.
Yeah.
Well,
No. I listen. My final thoughts are, number one, thank you so much. I appreciate the time. We've known each other for a long time, and I continue to be impressed with everything that you're doing and how much you serve our island. Service is the absolute best thing that we can do in our lives. And it's what you're dedicated to, and it's what I'm really trying to make sure I dedicate myself to every single day. So I really appreciate this time, sharing the good word and talking about COVID-19, and hopefully we'll get a chance to talk again, because this is something we're going to continue to face as an island. And because it's this changing infection, and it changes our society, you know, we're guesstimating about what we do. Tomorrow, you and I both may have a new conversation, and this thing took a whole different direction. You know, so I think as long as we keep the conversation alive, I think, and as long as we keep the best heads on our shoulders, I think we're going to get through this and we're going to do well.
Thank you.
You know,
the feeling is very mutual. You've been a good doctor and a good friend for our family for years. I always appreciate your advice, and you're one of the people I go to, whether it's stitches on my son's foot or just a question in general, or, you know, what's going on in the neighborhood. So thank you for your time tonight.
Always.
And I hope you guys' family stay safe. And I would say, I think your message of this weekend, be careful, you know, wear your mask,
Yes.
Stay within your family bubble, and
You got it.
take your health into account, because really it's, you know, you wearing your mask to help others. It's not
Yes.
so much for you, it's protecting
Yes.
your ohana by keeping yourself safe. So thank you for that.
You got it. You got it.
Message to the public. Yeah.
All right. All right. Well, everyone have a wonderful weekend. Be safe and God bless.
Thank you very much, sir. Good to talk to you. And ahuyo.
All right, brother. Aloha.
Aloha.